Okay, so in this video I am going to be demonstrating how to perform a wound irrigation. Since I don't have a patient or a person to use, I am going to use this apple instead. Alright, so the first thing that we would do if we were doing this on a real patient is we would review the medical orders, and we would perform hand hygiene and come into the room and identify that we have the correct patient. And also we would assess if the patient would need any pain medication before the procedure is done. And then we would assemble all of our equipment on or near us. So the equipment that we would use is we would need sterile saline, a syringe, a sterile container. Since I don't have a sterile container, I'm going to use this jar. And we would also need gauzes to change the dressing, and a basin. Okay, so now what we would do is we would put on our personal protective equipment, but for this video I'm just going to put on gloves just for the demonstration. So we would use sterile techniques, so that would be the cuffing method, but could also use clean gloves depending on the type of wound that you are caring for. So once you have your equipment on, we would assist, this we would do prior, but we would assist the patient to a comfortable working height, typically at elbow level for us, and also offer them a bath blanket if they were cold to cover any exposed areas, excluding the wound. Okay, so now that we have our protective equipment on, we would carefully remove the soil dressing and assess the color, the size of the wound. We could measure it in millimeters or centimeters. We would also check for any eschar, any epithelialization, drainage, or odor coming from the wound. So we could dispose of the soil dressing into the receptacle. Okay, and then we would remove these gloves. So we'd remove these gloves and then put on sterile gloves to move on to our sterile field and pour the sterile solution into the sterile container. Drip a little bit into the receptacle and then pour it into our container. And we would label the date and time on our container, and it can be used or reused if it is under 24 hours. It will still remain sterile. Alright, so and then we would apply a basin underneath the wound so that we have a safe place to irrigate it. And we would take the syringe. I'm just going to lower the camera a little bit so you can see. So we would take the syringe and basically fill it with our saline. So then, with our non-dominant hand, we would, if you were doing this on a patient, you would place the basin right underneath the wound, sealing it with the skin, just like that. And then we are going to irrigate it and flush it all over the areas, approximately 1 inch above the wound, and you would continue to do so until the saline starts flowing out clear. Okay, and so after this, you would dry the wound with another gauze, and then you would apply the new dressing. Okay, so after you apply and secure the new dressing, you would label it with the date and time, and then you would remove your or you would make sure that the patient is in a comfortable position, that the bed is in its lowest position, and that the side rails are up. And then you would remove your personal protective equipment and make frequent checks on the wound about every shift, or even more often if the wound is more complicated. And that is it.